Have you ever felt a burning sensation rising from your stomach into your chest after eating? Many people experience occasional heartburn, but when it happens repeatedly, it may be a condition called GERD, or Gastroesophageal Reflux Disease. Left untreated, it can affect daily life and even damage the esophagus over time. So what exactly is GERD? GERD is a digestive disorder that occurs when stomach acid repeatedly flows back into the esophagus, the tube that carries food from the mouth to the stomach. This backward movement of acid is called acid reflux. Normally, when food enters the stomach, a ring of muscle called the lower esophageal sphincter, or LES, closes tightly. This valve-like muscle prevents stomach contents from moving back upward. In people with GERD, the LES becomes weak or relaxes when it shouldn't, allowing stomach acid to escape into the esophagus. The stomach is designed to handle strong acid because it has a protective lining. The esophagus does not have the same protection. When acid repeatedly enters the esophagus, it can irritate and inflame the tissue, causing symptoms. The most common symptom is heartburn, a burning sensation in the chest that often occurs after eating or when lying down. Other symptoms may include a sour taste in the mouth, regurgitation of food or acid, difficulty swallowing, chronic cough, sore throat, and hoarseness. Several factors can increase the risk of GERD. These include obesity, overeating, smoking, pregnancy, certain medications, and foods that relax the lower esophageal sphincter, such as fatty foods, chocolate, caffeine, and alcohol. If GERD continues for a long time, it can lead to complications. Chronic inflammation may cause ulcers, narrowing of the esophagus, or a condition called Barrett's esophagus, which can increase the risk of esophageal cancer. The understanding of GERD has improved as scientists studied stomach acid production, digestive function, and the role of the lower esophageal sphincter in preventing reflux. Treatment often begins with lifestyle changes. Losing excess weight, eating smaller meals, avoiding trigger foods, and not lying down immediately after eating can significantly reduce symptoms. Medications may also be used to reduce acid production or neutralize stomach acid. Today, artificial intelligence is helping doctors detect digestive disorders more effectively. AI systems can analyze endoscopy images and medical records to identify inflammation, ulcers, and abnormal tissue changes in the esophagus. Some AI-assisted endoscopy tools can highlight suspicious areas in real time, helping doctors detect complications earlier and improve treatment planning. GERD is more than occasional heartburn. It is a condition caused by repeated acid reflux that can damage the esophagus if left untreated. Understanding how it develops helps us make healthier lifestyle choices and seek treatment before complications occur. But acid reflux isn't the only condition that can affect digestion. In our next video, we'll explore stomach ulcers explained and discover how damage to the stomach's protective lining can lead to pain and serious complications.